Hi, my name is Jonathan Packman, and I'm going to be talking about cognitive behavior therapy as an effective intervention for temporomandibular disorder, also known as TMD. Uh, TMD is a dental complaint where patients report pain in their jaw muscles or mandibular joints, and there's a lot of causes for the pain for this pain, but one prominent cause of TMD is grinding, teeth grinding while sleeping, and that's referred to as nighttime bruxism. Bruxism is thought to contribute to teeth cracking, chipping, premature wear, and it's become actually fairly prominent during the pandemic. People are more stressed, and stress and anxiety can lead to teeth grinding. And so you might have talked to people who say that they're grinding their teeth at night and their jaws hurt in the morning, and this is one of the reasons. So this is a timely topic. This particular study that I'm referring to was actually done in 2002 by a dentist at the University of Washington named Samuel Dworkin and his team. And they looked for a reliable, valid system to study the affected population. So they focused on a particular population of dental patients who presented to the orofacial dental clinic at the University of Washington, and they worked out a method for identifying patients who weren't influenced by other potential dysfunctions such as depression or anxiety from another cause. Subjects were, as I said, referred to oral facial plane clinic at the University of Washington, and they wanted to have their TMD related pain assessed. They self-reported facial ache or pain from muscles of mastication, which is chewing, the ear region, and those are typical symptoms of TMD. Patients selected through the research diagnostic criteria for temporomandibular disorder, the RDC-TMD, was a dual axis system for diagnosing and classifying TMD patients, which made them candidates for participating in this study. The study was designed so that there was two different groups. The usual treatment group was a group that was treated in the normal way. They'd be treated by dentists with pain relief prophylaxis, and a different group, the self-care group. And that self-care group was performed by hygienists that helped patients with vital information about TMD and other techniques to help with treatment at home. The usual treatment group, 63 participants, included physiotherapy, basically ways of preventing the jaw pain, patient education, prophylaxis or appliances, night guards, and medication, pain relief medication. The self-care group included 61 participants, and those patients received education, guided reading with structured feedback, relaxation and stress management training, self-monitoring for the signs and symptoms of bruxism or TMD, and development of a self-care plan. They received supervision and maintenance and relapse prevention attention from dental hygienists. There were 4 measures for self-reporting: helpfulness of the treatment in reducing pain, helpfulness of the treatment in improving ability to cope with pain, and increased knowledge about TMD, and then satisfaction with treatment. These are all self-reporting measures at the end of the study. So what the study found is that the self-care group reported significantly better results at the end of the treatment period for self-care than the usual treatment. So for example, responding to the question, how helpful was treatment you received in reducing pain? On a scale of 0 to 10, the self-care group reported a mean score of 7.6 versus 5.7 for the usual treatment group, with a significant error score of scale of 0.2. In conclusion, cognitive behavior therapy showed better self-reported outcomes. The participants received education on TMD and cognitive techniques, reported better improvement in 3 of the 4 study measures in comparison of the usual treatment group. In one other measure, which was on a scale of 0 to 5, there was a less of a significant difference, but there was still a difference between the self-care group and the usual treatment group, 4.5 versus 4.1 out of 5. The carefully structured minimal interventions emphasizing self-management, including the use of cognitive tools, may offer real benefit to a significant number of patients. And the other outcome is that uh, patients who were in the self-care group needed less care from dentists. And that is something that could end up requiring be a less expensive form of treatment in the future. Weakness of the study is that the usual care group received education from dentists, and dentists are not known to provide really great education. Hygienists are more well-trained in providing patient education. However, the strength of the study is that the study limited its scope to a particular population of patients, and they presented a specific set of physical symptoms. The study also replicated an earlier randomized controlled trial of the same methods, and this study confirmed the same results. Thank you for your time.